for joining us tonight. The State Department of Health Services says more than 35,000 people were vaccinated against COVID-19 yesterday. That is the highest one-day total since vaccination started last month. To date, more than 440,000 doses have been administered in the state.
Of those, a little more than 83,000 people receiving both doses, making them upwards of 95% protected from the virus. That equates to about 1.4% of the state's total population. You've seen plenty of those needles going into arms by now, but what happens inside your body once the vaccine gets to work? Are there long-term effects? With new vaccines developed in record time, there are bound to be a lot of questions. Madeline O'Neill set out to answer them and dispel some common myths. Maddie?
Well, health workers have been battling the coronavirus for nearly a year. And of course, the vaccine is a huge boost. But officials knew as soon as it came, there would be another challenge: vaccine misinformation.
To watch it, take over the world basically was terrifying.
On St. Mary's Secondary COVID Unit, registered nurse Carly Winslow saw how COVID took over her world.
To see what it had done was unreal.
I'm ready.
So when a way to fight back became reality.
We were very, very pumped to have this vaccine. It was a long-awaited journey.
Even then, when it came Winslow's time to get the shot.
I'll describe it as, when you go out, say you're going to go to a lake and you go to jump off into the water and you're all excited to do it. And then you have that moment of hesitation.
Concerns muddied the waters. Could the vaccine affect her ability to have kids?
You see the other questions people are having and is it legit, not legit?
There are lots of things that sort of float around.
We're not just talking about coronavirus particles.
Social media, I love it, but it runs rampant with a bunch of myths.
But there's no effect on fertility.
Audrey Sethi, Associate Professor of Population Health Sciences at UW-Madison, says vaccines also don't alter DNA. Another myth he's seen floating around.
People shouldn't, think that there's going to be some genetic consequences of getting this vaccine.
A lot of people are asking about the technology.
SSM Health Dr. Allison Schwartz explains both available vaccines don't use any live coronavirus.
So actually getting the virus from the vaccine is not something that people need to worry about.
Instead, the COVID-19 vaccine uses what's called mRNA to go into cells and encode for spike proteins.
Those are the proteins that are on the coronavirus that allow the virus itself to enter into our cells. So the mRNA tells our body, kind of gives us instructions to make these, fake little spike proteins, which then our immune system will react to and start to build up antibodies.
The mRNA doesn't stick around, but the protection remains with a high effectiveness rate.
I think 95% is sort of higher than any of our wildest dreams.
Some people might feel like it was rushed. And I think it's important that people recognize that the science behind the development of this vaccine is about 2 decades in the making.
Sethi and Schwartz say large amounts of funding, effort, and participants in overlapping trials helped bring about the COVID vaccine so quickly.
I think it's a really amazing feat of science and collaboration within the scientific community.
Side effects happen, but nothing alarming on a large scale. And symptoms such as a headache or fever mean the vaccine's working.
It was not bad. Thought it was going to be a lot worse.
Some research and reflecting.
It is safe. The risks are very, very, very low.
Cleared the way for Winslow to take the plunge.
It is totally up to you. Get your facts, though, before you go in thinking that this is going to completely do X, Y, or Z.
In addition to the mRNA, the COVID-19 vaccines also have preservatives found in other commonly used vaccines. Now, if you do have a common food allergy, even to eggs, you are still okay to take this vaccine, but there is a substance you can be allergic to in the vaccine. I'll make sure I get it right, polyethylene glycol, that if you are allergic to that, you should avoid the vaccine. And we do have more information on that on our website.